Hey everyone, and welcome back to the channel. Today, we're talking about something incredibly important, your liver. Think of it as your body's master filter, processing everything you eat, drink, and especially the medications you take. While medicines are designed to help us, some common ones can silently cause harm to this vital organ, especially if used incorrectly. It's crucial to be aware of the risks. In this video, we're going to break down 10 common medications that could potentially damage your liver and, more importantly, the early warning signs you should never ignore. Remember, this information is for educational purposes, and you should always consult your doctor before making any changes to your medication regimen. So, how exactly can a pill meant to heal you end up hurting your liver? When you take a medication, it travels to your liver to be broken down and metabolized. During this process, some drugs can create toxic byproducts. A healthy liver can usually handle this, but repeated exposure to high doses or mixing certain medications can overwhelm it. This can lead to inflammation, known as hepatitis, scarring, called cirrhosis, and in severe cases, liver failure. The risk gets even higher if you drink alcohol regularly, have a poor diet, or already have an underlying liver condition. It's a delicate balance, which is why understanding the risks is your first line of defense. Now, let's get into the specific medications. First up, and this is a big one, is acetaminophen, also known as paracetamol or Tylenol. It's found in hundreds of over-the-counter cold, flu, and pain remedies. While it's safe at recommended doses, it is the single most common cause of acute liver failure worldwide. The danger lies in taking too much, either in a single large dose or by taking multiple products containing acetaminophen without realizing it. Combining it with alcohol is especially dangerous, as it dramatically increases the toxic effect on your liver. Always read the labels and stick to the recommended dosage. Next on our list are NSAIDs, or nonsteroidal anti-inflammatory drugs, like ibuprofen. Many of us reach for these for headaches, muscle pain, or inflammation. While they're effective, frequent or long-term use can lead to liver inflammation and can also be tough on your kidneys. If you already have a liver condition, the risk is significantly higher. It's a reminder that even common, over-the-counter drugs need to be used with caution and respect for their potential side effects. Now let's talk about statins, the widely prescribed drugs used to lower cholesterol. For most people, statins are safe and effective. However, they can sometimes cause an increase in liver enzymes, which is a sign of liver stress or inflammation. Your doctor will typically monitor your liver function when you start this medication. The risk increases with long-term misuse or when combined with heavy alcohol consumption. It's a classic example of why regular checkups with your doctor are so important when you re-on long-term medication. Number 4 is a category we've all likely taken at some point, antibiotics. While they are lifesavers for fighting bacterial infections, certain types, like amoxicillin clavulanate or erythromycin, can trigger an unpredictable reaction in the liver. This can range from mild inflammation to a more severe, allergy-like injury. It's not common, but it's a known risk, and it's why antibiotics should only be taken when absolutely necessary and exactly as prescribed by your doctor. Coming in at number 5 are antifungal medications, such as ketoconazole and fluconazole. These are used to treat fungal infections, but they can be tough on the liver, especially when used for a long period. They are known to have the potential for liver toxicity, which is why your doctor will often monitor your liver health if you need a long course of treatment. Next are antidepressants. While modern antidepressants like SSRIs are generally safe, in rare instances, they can lead to elevated liver enzymes or contribute to fatty liver disease. It's not a common side effect, but it's something to be aware of, especially if you have other risk factors for liver problems. This highlights the need for open communication with your doctor about any side effects you might experience. At number 7, we have anti-epileptic drugs, used to control seizures. Medications like valproate and phenytoin are essential for many people, but they can put chronic stress on the liver over time. For some individuals, this can lead to significant liver damage. Regular monitoring of liver function is a standard part of care for patients taking these medications long-term. Finally, we have hormonal medications, like certain birth control pills or hormone replacement therapy. Long-term use can sometimes alter the flow of bile from the liver or cause a mild increase in liver enzymes. While the risk of serious liver problems is low for most healthy women, it's another reason to have regular discussions with your healthcare provider about the risks and benefits of your medications. Now, what are the early warning signs that your liver might be in trouble? Pay attention to persistent fatigue, nausea or vomiting, and pain in the upper right side of your abdomen, right below your rib cage. Other key signs include dark-colored urine, pale or clay-colored stools, and jaundice, which is a yellowing of your skin and the whites of your eyes. Itchy skin and easy bruising are also red flags. If you experience any of these symptoms, especially while taking a new medication, it's crucial to contact your doctor right away. Don't just stop taking your prescribed medication on your own, but seek medical advice immediately. Your liver is resilient, but it's not invincible. Being informed is the best way to protect it. Always take medications as directed, read all labels, and be honest with your doctor about all the drugs, supplements, and alcohol you consume. Thank you so much for watching. If you found this video helpful, please give it a thumbs up, subscribe for more health content, and hit that notification bell. Stay safe and be well.